Welcome to the Addiction and Co-occurring Disorders Treatment Manual video series. In this video, we're going to be talking about enhancing self-efficacy. Self-efficacy is the belief that you have the ability to change things in your life, that you can do something, and by doing something, it actually will make the difference. In prior videos, we've talked about motivation, we've talked about readiness for change, and we've talked about setting goals. So you are, theoretically ready and raring to go. The final icing on the cake, if you will, is believing that you are able to do it, that you are able to actually make a difference in your life and achieve what you define as a rich and meaningful life. Efficacy is defined as your belief in your ability to manage your physical and health conditions. This can be through medications, through treatments, or just through behaviors like eating well or getting enough sleep. You need to have efficacy that you can manage your affect or your moods, that you can feel feelings without being overwhelmed by them and choose what to do to improve the next moment. You need to believe and have efficacy that you can address your thoughts, that you can learn, that you can focus, that you can make decisions, and that you can make good decisions. You need to believe that you can make changes, that you can do things to improve your environment. And you need to believe that you have the ability to do things to improve your relationships. Self-efficacy involves judgments of personal capabilities that change according to the task involved. So you may believe that you can improve your relationships with your coworkers, but may be questioning whether there's anything you could do to improve your relationship with your significant other. It's important to recognize your level of efficacy or your level of confidence and identify things that you can do to improve your confidence. People who lack confidence in their ability to recover are less likely to engage in their recovery tasks. You're less likely to do what you need to do, and you're less likely to continue or persevere when the going gets tough. Lack of confidence in daily life and anxiety or depression have serious impacts on your overall status, health, well-being, and your willingness to do things. Higher self-efficacy or self-confidence means there's a higher probability of success, which could make you more likely to be willing to try and do things. If you believe that if you try, you will succeed, you're going to be more willing to try. Self-efficacy influences your level of effort and attitude toward difficulties and behavioral choices. If you think, well, there's no point, or I've tried this before and I failed, that shows low self-efficacy, which means you probably won't be super excited to try again. But if you see it as a challenge, then you might say, okay, well, I did this before and I, was symptom free. I was in recovery for 3 months and then I relapsed. All right, let's see if we can go longer than 3 months this time. Self-efficacy is that belief that you can improve your situation. Self-efficacy affects your way of thinking, which could determine whether you're willing to take action at all. So take some time right now and think about how effective and confident do you feel in your ability to improve your situation, in your ability to do what needs to be done for recovery. How likely do you think it is that you can make a positive change in your life right now? You not change your entire life right now, but you can make one small change that will help move you closer to that eventual goal of recovery. How confident do you feel that you can start doing one thing right now? There are ways to increase your confidence or your self-efficacy. The first one is called rehearsal and mastery experiences. So, for example, one of the things that we do in treatment a lot is refusal skills, practicing that, practicing assertive communication with people, because a lot of times we have not developed the best coping skills, the best communication skills. So, practicing these in session with your therapist or with your best friend can help you feel more confident at doing it. A lot of times you're going to want to rehearse before you do something for real. And the same thing is true in treatment. Another skill that you may rehearse is distress tolerance skills. So when you start to feel feelings, anticipate what will it feel like when you start to get angry? And what are some skills that you can use to deal with that anger? Now let's practice using those skills. Another tool is guided imagery. You can envision yourself successfully accomplishing a goal, successfully having a conversation with somebody that is going to be uncomfortable and having it go well, successfully going through an entire day without using, successfully laying down to go to sleep at night and sleeping through the night. What will that look like? Guided imagery helps you see yourself doing it, and it actually trains your brain to sort of expect the next right thing to happen. A third intervention to help you increase your sense of confidence is to use role models. Who are your role models? Who are other people who've done the same thing that have proven to you that it is possible? If you do this, then you will be one step closer to your goal. Make a list of three to five role models, if you can find them, that have accomplished a similar goal. That way you can look to them for hope and inspiration. A fourth tool is social support. Sometimes we need a cheerleader. Just like if you were on track and you were running around the track and you were coming towards the finish line and you were starting to run out of gas. If you had somebody in the stands going, I know you've got this, you can do it, pull that energy out of somewhere. You probably pulled it out of somewhere because you heard them saying you can do it. And you started telling yourself, you know what? I can do it. So who can you get that encouragement from? And the last intervention that may be helpful is called biofeedback. And this can help you mediate your emotional states. When you start feeling anxious or you start feeling hopeless, it's important to notice how that feels and to practice slow breathing so you can help yourself calm down, and to regulate your emotions so you can use your energy to make that positive change. Consider practicing a lot of your new tools. Consider practicing a lot of those tools that have worked in the past. Envision, use that guided imagery to see yourself using those tools in the future to help you deal with anxiety, anger, cravings, triggers, anything that might pose an obstacle in your recovery process. Efficacy involves a lot of things in recovery. It's important for you to look at your efficacy on specifics, not just recovery as a whole, because there's so much involved in that. What is your belief? What is your confidence that you can handle cravings? What is your confidence that you can handle fatigue? What is your confidence that you can handle sleep problems or pain? What is your confidence that you can handle anxiety? What about depression? What about anger and resentment? What about guilt? What about grief? For me, for example, I'm pretty confident that I can handle anxiety and I know how to handle depression. When it comes to guilt, I'm not as confident in my skills. And it's important to recognize what areas you might need extra support in, what areas you might need to focus on. Cognitively, what is your confidence in your ability to control what we call in addiction recovery stinking thinking or a negative mindset? What is your confidence in your ability to keep those negative tapes from moving you backwards? What is your confidence in your ability to cope with environmental triggers? When somebody walks past you that you used to use with, when somebody is drinking in front of you or smoking in front of you, what is your confidence in your ability to handle that? And finally, what is your confidence with regard to your relationships, your ability to develop supportive relationships? Do you think you can do it? What tools do you need to help you be more confident in your ability to develop and maintain supportive relationships? How confident are you in your ability to set and maintain healthy emotional and physical boundaries? And what tools do you need in order to be able to do that? So go through each one of the things that's on this slide. Identify your level of confidence in your ability to handle that. Identify strategies that have helped you handle that in the past, and identify any new strategies that you might want to try, so you are prepared to handle any of these things that could be potential relapse triggers. Other tips, just to kind of round it out: write down in your journal, have an entire page that is just filled with self-affirming statements that tell you that you are able, you are capable, you are strong, you are courageous. Avoid comparing yourself with people further along in the recovery process than you. Your recovery is your recovery. You may be dealing with a whole different set of circumstances and history, you probably are, than they are. So it's not a fair comparison. It's important to recognize what you're dealing with and compare yourself to you and be the best you can be each day. Join a support group. It doesn't have to be a 12-step group. It can be Smart Recovery. It can be Celebrate Recovery. It can be something that's, more generic, that where you can get support. Maybe you need support for grief that you're going through. Maybe you need support for anger management. Whatever it is that you have difficulty dealing with, or you want support in dealing with, or you want encouragement from people who get it, join a support group. A lot of support groups are face-to-face, but there's also a lot of support groups online. Don't use "there's no support group in my area" as an excuse to avoid getting social support. Avoid detractors and unconstructive critics. Now, there are going to be some people in your life that may offer constructive feedback, and we don't want to avoid the constructive feedback. But if somebody's just being nasty and ugly and hateful, you don't need to subject yourself to that. So avoid being around people who are still engaged in stinking thinking and who have difficulty communicating assertively. And if you can't avoid them, figure out how you are going to set healthy boundaries so it doesn't negatively impact you. Get a coach or a sponsor or a counselor to help you through this process. This is not an easy process. Whatever you're recovering from, recovery is not an easy process. You need a cheerleader along the way. Start each day with dedication to your recovery. Spend a minute, 2 minutes. It doesn't have to be this huge, long, drawn-out thing. Spend a minute or 2 minutes looking in the mirror and telling yourself, all right, you deserve to be happy and healthy, and this is what we're going to do today in order to stay on the right path. Bada bing, that's it. It doesn't have to be this huge, drawn-out ordeal. And keep a log of daily, weekly, and monthly successes. Don't ignore the little successes. If you went to the entire day and didn't have a craving, that's a huge success. If you went an entire day and didn't use or didn't cry or didn't get angry or whatever it is that is your problem, make sure that you give yourself credit for a day of success and not say, well, it only counts if I go for 30 days. No, it counts. It counts if you go for an hour. It counts if you go for a day. Keep giving yourself those rewards to remind yourself that every moment is a step closer to your goal. Think about, where are you today? And this kind of goes along with that stage of readiness for change. With any behavior that you've got to do today, it can be going to a meeting, it could be writing a letter to somebody, whatever it is. You could be down to, I won't do it, or I can't do it, or maybe I'm contemplating, I want to do it. In preparation, remember, we're saying, okay, I want to do it. Now, how do I do it? In the action phase, we're saying, I'll try to do it. Then we're moving to, I can do it, I will do it. And then finally, lo and behold, I did it. Change is a process. We need to get from pre-contemplation, like we talked about, all the way through that action process to where we've made the change that we set out to make. Final thoughts. People with a strong sense of self-confidence or self-efficacy view challenging problems as tasks to be mastered. We view them as challenges and opportunities and something that's exciting that gets our creative juices flowing. We believe that difficult tasks and situations are an opportunity to grow, and we're determined to keep going and persist even when it gets tough. People with strong self-efficacy recover quickly from setbacks and disappointments. We recognize that that's part of the learning process. We focus on personal successes and positive outcomes, and we're able to separate our value as a person from our successes and failures. Even if we relapse, even if we make a mistake, even if we don't do something exactly the way we had wanted to do it, it doesn't mean we're not a good person. It just means our behavior may have been a poor choice.